Hi, everyone. Thanks for dialing in for today's virtual discussion. We're going to get started in just about a minute or two. Feel free to use your chat to say hello, your name, where you're from. We'd love to say hi to you. We're just waiting for our last couple of panelists to come on board, and then we'll get started. Hey, Georgette, do we have audio on you? I can see you dial in, Georgette. Don't have audio yet. And I see Chris Vaughn. Hey, Chris, how's it going?
Hello.
Hey, Chris Vaughn.
Hey, Tom Moran.
So you're probably wondering why I'm wearing a sweatshirt, because I'm the only one in my house freezing while everybody else is walking around in short sleeve shirts. I gotta turn
So hi to Rachel from Colorado Department of Office of Emergency Management. Again, feel free to say hi while we're waiting for the last bit of participants to dial in. Georgette, still no audio on you. We'll get started in just 1 minute. Again, feel free to use the chat to say hi to us here at the All Hazards Consortium and say hi to our panelists. We'd love to hear from you.
Chris Vaughn, I was teasing Jeff. Jeff looked like he was actually in the office. I was so convincing. His background was, I thought.
Hi to Robert Trau-Massey. Welcome. Alan Bradshaw from Dominion Energy. Hello. Georgette, any luck on your audio?
Yes.
There we go.
Hear me.
All right.
There we go.
Thank you.
And saying hi to Emma Paz from City of Charleston. And if you guys are ready, I'm ready.
Let's roll.
Let's roll. Well, welcome to the All Hazards Consortium, a business resilient virtual discussion series. Today, we're going to talk about GIS and the role of COVID-19. We all know that GIS and location intelligence has been crucial during the pandemic. We're going to take a deep dive today into how GIS has been used, but also how GIS has morphed over the past 3 months. So let me go ahead and move my slides. For those of you who I haven't met, I'm Laura Johnson. I'm the Director of Conferences and Events for the nonprofit organization All Hazards Consortium. Just a couple of quick administrative remarks before we get started. Just wanted to remind everyone we are recording today's webinar, and we will send you the link post-discussion. So if you want to share that with your colleagues or peers or have to leave early, you will get the full recording. Also, you've been muted upon entry, but feel free to use the Q&A option or the chat option to send questions to myself or the panelists. If it's for a particular panelist, just indicate that, and we will try to get to that. If not during the panel discussion, then we should have plenty of time at the end. And now I'd like to introduce Tom Moran, who's the Executive Director of All Hazards. Tom?
All right, thank you, Laura. Welcome, everyone. And let me welcome our panelists. Today is, we're just going to touch the surface here on a very important topic. When we were having our panel call, Chris Vaughn and I were talking, and Chris said, why is the All Hazards Consortium interested in GIS? I think it's what you said, Chris, and I thought, yeah, that's a good question. What the consortium does is work on public-private problem solving, and to do that, you need to make decisions. And you can't make decisions without data, and you need to make them quickly. And so having a GIS component into this is critical to quick authoritative decision making, so people can restore infrastructure. So today you may hear about the SISE, the SISE. It is a legal framework established by the private sector in 2015. It protects people and information. It vets people and information so that it can be put into problem-solving committees and things like that. So we keep information and people focused on a specific problem. And it's just not kind of this open forum for everybody to see everything. The private sector is not comfortable, neither is government. The SISE protects information from FOIA requests that are irrelevant or competitive in nature. Certainly, we stay very legal. We're audited every year, but the SISE provides a framework that government and private sector both need. And the role of GIS is really critical. The more we build these solutions, the more we're relying on, this, how do we organize information so decision makers can look and make a decision in 30 seconds and not waste an hour validating information. So if you hear about the SICE, that's kind of the backdrop here. So I'm really happy to have our panelists together. This is a great cross-section of specialists here. So we'll jump into it. Laura, I'll turn it back over to you, and looking forward to our talk today.
All right, thanks so much, Tom. So I'd like to introduce today's panelists, and we have quite a few prestigious panelists today, and we're going to ask them about 4 questions about their use of GIS. So please welcome Jeff Arani with Esri. We have Georgette Holmes, not on video, but on audio from DHS CISA. Chris McIntosh, you may remember from previous webinars from Bent Ear Solutions. Welcome back, Chris. We have Rob Shankman from HHS, and last but not least, Chris Vaughn from FEMA. Welcome to all of you. Today we're going to start with the issue of GIS, and I'm going to ask Chris Vaughn if you can start with this question, and also tell us a little bit about yourself. We're looking if you can describe the GIS related issues that came up during COVID-19. Chris?
Yeah, thank you very much. And first, let me just say what a pleasure it is to be here, not only as part of the AHC brief, but to be a part of such a distinguished panel. All these folks on the panel are my friends and colleagues. I've known them all for a really long time. I'm trying to figure out some sort of a pithy statement to come back at Tom. I've known Tom for a long time. I mean, definitely, I think my first real AHC run-in with Tom was, Sandy? I mean, it's probably been before Sandy. And my question, Tom, was probably more to do with, what are you up to now? Because when I first really met Tom, it was, he was messing around with SATCOM dishes and doing some just great work. So I'm very grateful to know Tom, and just really respectful for everything that the AHC does for the community. So, Laura gave me the hardest question. There's a couple of questions in this, and somehow I ended up with the hardest one. Like, what are the issues?
I think you can handle it, Chris.
Yeah, thanks. I think, just at the onset, I'm a natural hazards kind of guy, right? So I am I'm most comfortable in a flood situation, tornado situation, that kind of thing, where that's a much more routine, my comfort factor. From a pandemic situation, first of all, none of us have been in a pandemic situation like this, unless you were born prior to 1918. And so at FEMA, we really rely on our interagency partners, and early, right off the bat, no questions asked, we reached out and established a really good connection, and had already an existing connection with Rob Shankman and then Bob Neurath, Rob's counterpart at CDC. So you're going to hear a lot of great stuff from Rob and what the HHS team did in relation to establishing the U.S. government COP for this pandemic. So I can only speak for me personally and kind of where we were coming from. Issues being, I've never had to deal with any kind of pandemic type thing before. So as a result, there's 3 main buckets. I've been putting everything into 3 main buckets. The first bucket being data, second bucket being analysis, and the third bucket being coordination. And so that sweet spot obviously is the analysis. The top part of the analysis is all the models, the short term, the midterm, the long term modeling. Short term in the sense of 7 to 10 days out, midterm, somewhere in the 2 to 3 week range, and then long term, months out, trying to project where this thing was going from a forecasting perspective. And you want to know all that because the second half of that is, what do we do about it? So what, now what? So the second half of that analytic bucket is all about resource allocation. So if you kind of look at it, once again, data analysis broken down by these 2 factors, and then coordination, GIS played a role in all 4 of those quadrants. And we started with scratch. We had nothing really. I mean, the modeling, a lot of kudos and compliments to the CDC team. Ultimately, right now, if you go to CDC and you look up a, CDC forecast, I'm sorry, I don't have the URL, but if you look that up, CDC has put out an ensemble. So, they basically crowdsourced a lot of these models that are out there, whether that's from MIT, Lawrence Livermore, Johns Hopkins, University of Washington. So the best, brightest, biggest brains on the planet came together and they've published their methodologies. That's all well and good. You need the data to go with it. And so a lot of compliments out there to, open source data providers, not only CDC, but also open source data providers like USA Facts, 1.3 Acres, a number of folks that are out there that were harnessing and scraping all this information together in a very open and transparent way that fed the models. And then that second tier of analytics, once again, is resource allocation. And I mean, come on, we had to retool liquor factories to start making gin, hand sanitizer stuff, and so, Rob's going to get a kick out of this and laugh his butt off because we were trying to, well, how many hand sanitizer bottles do you think we need? And so, they're coming up with calculators for how many hand sanitizers we need, or how many gloves we need, how many face masks. And so we did have a lot of issues, but, it's only because it was the biggest thing that any of us had ever faced before. It was a worldwide issue, and we really didn't know when and where this thing was going to end. You're going to hear Jeff Barani speak, and it was very, very quick in this incident that we all just kind of came together and said, man, we are progressing so fast and furious. And we honestly felt like every week that we went through this, we as the geospatial community were actually advancing by 3 years. And so after like 8 weeks into this thing, we're like, we're 50 years ahead of where we were just in early March. So a lot of issues, but they weren't insurmountable. They did overcome. And I think it's all about the power of partnership and relationships and communication. And, I really got to give a lot of kudos to the folks on the line that you're going to hear from today. So thanks for letting me be a part of this.
Yeah, and Chris, you're so modest. You didn't tell us what you do for FEMA.
I'm still trying to figure that out. Yeah, I'll see what my colleagues think I do for FEMA, but official title, and titles really don't mean anything, right? So my official title is the Geospatial Information Officer for FEMA. All that really means is that I'm an advocate and a champion for the great work that FEMA's just got some amazing people that they can code, they can dice, they can slice, they can Julianne, and it's a very humbling experience to be part of the team. And then quite frankly, this interagency team that we have with, Georgette and the DHS folks, I mean, we really all do rally together very quickly, and intersect with folks like All Hazards Consortium to try to push and promulgate information. So I'm the head of this bit over at FEMA, but in charge of no one.
Okay. And Chris, you mentioned the CDC forecast model. If you get a chance to type in the URL in the chat box for all of our listeners, that would be great. And I'd love to move on to Georgette. Georgette, if you can say hi and let us know a little bit about your background and how you would answer this question.
Okay, so my name is Georgette Holmes. I am the Acting Data Analysis Branch Chief at the National Risk Management Center within the Cybersecurity Infrastructure Security Agency, CISA. So basically who we are, so the NRMC, we're basically a center of collaborative risk management. We work closely with critical infrastructure community to identify and analyze significant risks to our nation. So we, work regarding in terms of sectors, critical infrastructure, we're looking into the 16 sectors, which range from communication to energy to transportation to the water sector and so on. So we work hand in hand with private sectors, government agency, and key stakeholders to try to identify not just the physical side of critical infrastructure, but also the cyber side of things. So to answer the question regarding issues that we faced, it's the same as with Chris Vaughn, what he stated. We were struggling with data analysis and coordination. At the beginning, we started to report on this back in February, putting out 1 our standard product, which is called the Infrastructure Outlook Brief. From there, we focus more on supply chain, looking at the insights, looking at impacts, disruption to the supply chain. We, immediately try to see how many cases, confirmed cases, and have authoritative data sets for those things. We wanted to know what are the travel restrictions, what are the impacts to like cargo or air cargo, the industrial impacts, the drug manufacturing, and the healthcare, the trading back and forth. I mean, we all within the supply chain, and that's the kind of like the field that we work with. So we had to do a lot of open source. We use Bloomberg to try to see what they have on analysis, but the struggle has always really been with data. And a lot of coordinations. We coordinate a lot with FEMA. I'm always hitting up FEMA, Chris Bond team, because they have the best connection with other federal agencies and state and local officials. But we also, work very closely with our sector-specific agency, our SSAs. These are designated representative for all 16 sectors, and it ranges between folks within DHS or, say, for instance, water sector, we reach out to EPA and, DOD and so on. So we rely on, their inputs and reporting. We rely on our, in terms of, we have regional office that kind of split up into the 10 FEMA regions. So we also rely on their inputs in terms of their situational reporting of what's going on in the field as well.
Georgette, thank you so much. Rob, I'd love to move to you if you can introduce yourself and tell us how HHS has been affected through all of this.
Sure. So my name's Rob Shankman. I am and we got a brand new branch name. So we are no longer the GIS branch because I said, why would we name a branch based on just a piece of software? That's like naming yourself the Excel branch. So we changed our branch to what we do, which is the Geospatial Integration Analysis Visualization branch. So it's a little bit lengthy, but it's exactly what we do. And so I've been the branch chief here ever since there was a branch, which is now at FEMA, or not FEMA, at HHS going on. I've been here for 15 years. So it's been a long time. And in that period, Chris is correct, there has not been a pandemic. We have done some tabletop pandemics, which they're good, but they didn't really push us to the point that this COVID pandemic really did. And that gets to really your question here, which is the issues. We've always struggled with the data collection piece, and it's not that we can't do it. It's that HHS and ESF 8, which is the health and medical, we don't own any of the healthcare sector. So it's very difficult for private hospitals or public hospitals, but not government-owned facilities, to feel comfortable reporting to the level of detail that we were asking them to report. So you're asking a facility to tell us how many patients you have in your facility, but that all comes back down to dollars. It comes down to billables, beds, and it comes down to, whether or not they want their competitor to know how close to capacity they are. So there was a lot of coordination and collaboration that had to happen in the middle of this, and as it ramped up to get to the point where we could get that information. So really that the buckets that Chris talked about, the data collection piece was huge for us. It always has been. We've had mechanisms to do it in the past when we've done the collection for a natural event. It's always been for a specific area. So you're looking at, the Southeast region. You're looking at the state of Florida. You're looking at the state of Texas and Louisiana. So you're looking at some of those regions and figuring out, what happens to those particular regions. And we can have emergency coordinators at those regions, at those state EOCs to pull that information. But when you're talking about a national event, something that that would require all of our emergency coordinators to be at every state EOC, it's not going to work. So we had to work through a different methodology to create a new way of doing data collection. Then the next piece of that, of course, is you get all the information in. Yes, the modeling groups start kicking around information and they start creating all these great data sets and great product. Well, now there's the second half of the equation as far as we're concerned. Now there's the data sharing. How do you get all that great information that we now just collected and disseminate it back to those people who need it, back to the senior leadership within the federal government to determine, to start making decisions on supply chain, on the PPE dispersal, on, whether or not we're going to move teams for healthcare. And then, other than the decision makers, you've got all these other groups, all these other federal agencies, state agencies, local health departments that also want to see all this information. They see their local information being reported, but you have one state reporting and they'd love to be able to see what their adjacent state is, and not everybody reports in the same format. So we were able to aggregate all that information, put it together, normalize it, and then reshare it back in what Chris has mentioned. So in our common operating picture. And so, we'll get to that, as we go down through all these questions, but we put together a series of methodologies for disseminating this data and coming up with these on the fly to serve the needs of all of the agencies, all of the users, and both internal, external to HHS, external to federal government, and approaching all of those hurdles and getting through them in the short time frame that we had to ramp up for this was a huge issue. And kudos to my team, kudos to Chris's team. We pushed all this information out and have been extremely successful in getting the information from those that are from those that are the data owners to those that are going to be the data consumer.
All right, Rob. You framed that up really well, and we will have questions that address later how you, in fact, disperse that information that you were mentioning and the methodologies that you use. So thank you so much for that. Now I'm going to ask Chris McIntosh. Chris, welcome back. I'd love you to introduce yourself and tell us a little about your work in GIS as it relates to COVID-19.
Thanks, Laura. I'm Chris McIntosh, CEO of Venture Solutions. We've been working to support some of the All Hazards Consortium initiatives around the response and recovery from COVID. I have three really quick things that I think above what was already been said by my colleagues. The first was this: we did a lot with supporting getting information from what's going on in the states and the localities. So what's the impact? And the emergency management community is notorious for issuing declarations in PDFs that say whereas for 2 pages, and then somewhere in there is a piece of data that somebody needs to know. That we're closing businesses or that we've changed the weight restrictions to something. So getting all that unstructured data, which for the first time ever was coming out of all the states at once, into some way that could be consumed by the various situational awareness systems that was going on across the public and private sectors is usually a challenge in a hurricane, but that's usually a half dozen states or so. But doing it across the entire country when new proclamations were being issued every day was an initial heavy lift. Thank goodness for organizations like the National Governors Association, the American Association, the American Trucking Association, because they began taking that on and giving us a place to go at first to manually update data, and then ultimately they actually started publishing services. That was a challenge. That's always a challenge. It'll be a challenge no matter what the disaster, but the scale of it, because it was the entire country, was brutal. If you go and look at just how many of these declarations were issued that affected transportation, that affected social gatherings, that affected just the states of emergency, it's thousands, and keeping up with that. That was a challenge. Second thing is, this also rears its head. Great organizations, FEMA, HHS, everybody knows the Johns Hopkins. Having to, what I focus on a lot at Ventir is the human, the operations side. What are they doing with the great products coming out of GIS teams? And having to broker what is the data that we're going to go with? What is the number for our organization on cases? Because you have some coming out of the state health department, you had some coming out of CDC, you know, there were arguments over, well, your dashboard doesn't match their dashboard, and having them come to a governance decision about what they're going with from a data source and knowing why they chose it, and knowing that everybody in the organization knew that they're going with this as the authoritative data source, and the pros and cons, because no one's perfect. And the third one is actually having to help rewrite operational procedures to use the great data and tools that were coming out of Rob's team and Chris's team. It's been said, none of us have lived through a pandemic. Now we dealt with a pandemic, and now we also dealt with, Chris said it well, an amazing evolution of the use of GIS technology that happened. We leapt forward a generation. The operational community was left behind. So bringing them up so they could use the tools that are coming out of GIS to make better decisions. It's very important that we explain to them how data is created, what the models are doing, how they can use that to influence decisions on whatever their specific area of responsibility or role was. So bringing the human side along with the explosion of the use of GIS was a big challenge. I think the community at large is better for it. Hopefully we can maintain that momentum. So that kept me busy and trying to keep up with Tom. So
that's a lot. Thanks, Chris.
And thank you for the opportunity to be on the panel with colleagues I've known for a long time and are doing fantastic work for the country. I really appreciate it.
Sure, Chris. And thanks to Michael from Esri for chatting to the panelists, a URL that looks very interesting. So I just re-chatted it to everyone on the line. So if you're not checking your chat, please do so. Some good information.
Laura,
yeah.
let me pull on that thread that Chris mentioned. This event affected every home. If you need toilet paper, you know, every business, every state. And for most of us, it's a once in a lifetime thing we've never seen before. And this was a great example. Chris mentioned unstructured data. You know, and for those of you, let me tell you what Chris and team were doing. They were getting files, PDFs, and freaking reading them, and then hand jamming the tweaks, right? The extra 8 words that came out in that document of 1,000 words. They would find the 8 that are new and plug them into Esri and update the dashboard. And this is the I think the challenge going forward is how do we eventually build a culture that people understand? Yeah, it's easy to just put a PDF together, but if you can get action, if you make it into a form that GIS can consume. And that's a big takeaway for this, because with unstructured data, we will never, it's like rotary phones, we'll never get out of this, right? We will always be using this unless we can build a new culture to understand the importance of this. It doesn't take that much work. It just, if everybody did a little piece of it, it wouldn't be the responsibility on FEMA or HHS, or these government to do it, right? But anyway, I appreciate what Chris was talking about there, and I didn't understand it until I saw it firsthand. So,
and it's very hard to automate when it's different every time.
Right.
That's the challenge.
Yeah.
All right. Thanks, Tom. And by the way, we've done about, I don't know, 12, 13 of these webinars, and whenever Tom Moran could get a chance to mention toilet paper, he does. All right. So last but not least, before we move on to question 2, I didn't forget about you, Jeff. I'd love to introduce Jeff Morani from Esri. If you can tell us a little bit about your work in this area. I know you're elbows deep in it, so welcome.
Yeah, great. Thanks, Laura, and thanks everyone for joining this afternoon. Yeah, my name's Jeff Barani. I'm with Esri. I'm the technical lead for emergency management and help coordinate operations for our disaster response program. Just a couple of quick things that chime in. This question. I mean, Tom, your points about the data are spot on. I mean, we saw the success of the things like the John Hopkins dashboard, and we saw that all over the news. But in my mind, the real secret to success of that was the data wrangling that went on behind the scenes. Looking at the WHO reports early on and other PDF documents and putting that kind of in a standard, context. And that's really, the data is really the fuel that drives the decision-making products like you saw with the dashboards. In terms of issues, I think, I did a couple of quick things, coordination for sure. I think early on, like Chris Vaughn and Rob talked about, public health needed to work with emergency management, and those were groups that don't traditionally work as closely as they, do now, today. And there's just an amazing amount of work that was done across, the GIS community, really kind of, working together and bringing that, all together. I never knew that there was a Excel branch before, so Rob, thank you for that. And I think, that's a common comment that we heard across our user community is, traditionally, people may slide a piece of paper under a GIS analyst desk and say, make me a map. And these events, people were just throwing spreadsheets at them left and right and say, map this, map that, and the fields would be different, all the time. And I think, successful GIS folks were able to kind of get out in front of that process and make it, more manageable, for sure. Rob and his team did an awesome job of just operationalizing, a tremendous amount of data and a lot of great work across the user community too, doing those, types of things. So the coordination wasn't, I think, it took a little bit to kind of get our sea legs underneath us, as I think Chris Vaughn said, early on in this, but, once that was in place, they were just off and running. And I think that's actually an asset now moving forward, the level of coordination that's happening, at different scales, local levels working together, the coordination that was done at, on the FEMA side with their geospatial coordination calls, it just exposed many more to what can be done with GIS. And this was really the first time is that all 50 states, and I think during the first call, we looked around on the FEMA call and said, this is the first time all 50 states are activated, with the same event, all 10 FEMA regions all working together. So the scale of this was just certainly phenomenal. But the community really rose to the challenge, I think, from a coordination perspective. So thank you.
Thank you so much. Okay, so let's move on to question number 2. The question is, how did you use GIS for COVID planning for response and or decision making? So Rob, I'd love to start with you on this question.
Okay. Thanks. So we were working on COVID ever since, let's say, late January, early February, as we started to get some of the early numbers out of China, and then early numbers from the CDC and WHO. And then we were working with our folks for patient movement as we started moving the folks off of the cruise ships. And that was really the beginning of how we got the United States involved in patient movement and having COVID on the shores of the United States. And so in order for us to work with our patient movement folks, in order for us to work with our operational side, we have always had dashboards. We've always used dashboards. And so we started creating a few dashboards, which turned into a dozen dashboards, which over the course of this pandemic has turned into, and I just went and quickly counted them, 18 different subject types that break down into 90 dashboards. So we have quite a few ways to slice and dice this data. And we even Julienned it. I'll put that one back in there for you, Chris. So we have the data, we have dashboards, and this goes back into how we use GIS. So we had our data collection methods. Some of them, yes, was strictly send me a PowerPoint, send me a PDF, and manually ripping the data out of there, and we would go into the database and update it. What we found was that takes a lot of time from my analysts and from all the other analysts that were working on this project. So what we found was, why don't we just create an app? So we weren't creating mobile apps because most of these people are not out in the field. Most of these people are sitting at their desk doing their work. So we were creating desktop apps that allowed them to gather the data, input the data, and save the data. And it would then repopulate our database and update the dashboard. I would say live, but it's not really live because it was just as they entered the data. So it was just near real time. And that worked out really well. And so we had between the early planning stages of patient movement and figuring out where these people were going to go and how long they were going to stay and how we were going to move them back. So they come off the cruise ship, they go to Texas. Well, they don't live in Texas. So then we had to fly them back to where their original destination was. So we were working on that. And then we moved into where the case counts were, where the airports that were testing initially, the 13 of them that we were initially running for testing for incoming. So this kept changing. And that was part of the challenge for us, is that, you know, you create an app, you create a dashboard, you create some sort of methodology for looking at this information and starting to make a decision. And then all of a sudden they say, oh, well, you know, we're no longer focused on this. We're now going to incorporate this other thing. So supply chain came into play. Patient movement kind of phased out, but then understanding patient load in a hospital, understanding which hospitals were getting close to being at 100, 110% capacity, and then where there were a hotspot and how that hotspot was going to somehow impact the facilities. So all of this kept changing and kind of ebbing and flowing in how we were going to use GIS data, how we were going to visualize the data, how we were going to create product, whether it's static product, whether it was dynamic on the dashboard product, whether it was both. So we had all of these kind of mashed together into one group of GIS staff, both from FEMA and from HHS, working together to knock out all of these products, all these dashboards, and had the dashboards shared throughout the federal agency. They were shared through the NRCC and FEMA. We had staff logged in from USDA, from FDA, from multiple federal agencies, all kind of looking at that same central common operating picture to keep us all on the same page and keep us all focused on the same data and cross-check each other's data as well. So, I mean, we've talked about the fact that some data is not necessarily correct when it comes out of the field and needs to be cleaned. Well, sometimes when you clean the data, you disturb it in a way that it wasn't intended to be touched, and therefore it starts to warp it and not be able to be used for that decision-making process. And so you would have inputs from census to say, hey, look, that population number isn't right the way you're using it. They jumped in, they said, hey, let us help you make an economic dashboard that shows, you know, how many employees and how many employers and how many businesses there are in that area to understand which ones there are and of what business category type they are, so you can understand better the population that's being released back when we start going back into these phase 1 and phase 2 reopenings. So that's really how we used it. So that's everything from planning, response, and decision making.
Wow.
Okay, thanks so much, Rob. So Chris Vaughn, Rob talked about the shared COP. How else did you and FEMA use GIS for your COVID planning?
I would say it was a part of, you know, obviously everybody's looking for data. I mean, I'm trying to figure out, I'm not trying to give you a cop-out answer, but, you know, the name of the game, at least for FEMA, was how bad is it? Where is it bad? You know, and so everything had a locational aspect to it. And going back to Rob's point of view, I mean, he really had the center of gravity for where we were porting all of our known data, the best available data the U.S. government had at our disposal that was going into Rob's system. And as a result, you know, arguably billions of dollars were allocated in terms of resources, gloves, masks, gowns. I mean, it was just like the top 6 or 7 things for the entire country, to include all the territories, 57. They just kept saying 57. And I'm like, 57. So you've got obviously the 50 states, you've got the territories, and that's it. I guess that's the number, 57. So we did deliver, resources to all of those. And then, I think one of the big takeaways is you really got to commend folks like HHS and their allocation of remdesivir, right? That was a big deal, right? And making sure that very, I'm not a doctor, right? So forgive me for using the wrong words, but using this very frail, fragile, very almost liquid gold kind of stuff. It had to be in a very temperature controlled environment, how to get the medication to where they needed to be in a very quick amount of time. You needed data. And so that's where a lot of people turned, was to GIS and Rob's, what'd you say, Rob? 50? How many dashboards did you have? I believe it.
Wow.
It was amazing.
90, Chris. 90.
I believe you. I mean, I remember the first day I came in and saw Rob. I mean, we've been friends for a long time. And he was talking to me about the gates of COVID. Christ. I mean, how many dashboards do we got? So, I mean, that was a lot of fun. I don't know if that answered your question. I'm sorry, Laura.
No, Chris, that's great. That's great. Georgette, how about you?
Sorry, get myself off of mute. So for us, I mean, we were basically in the same boat as FEMA and HHS, but more on the, of course, the supply chain. But also one of the things we were doing is, like, we were receiving a lot of unstructured data, and it required us to start, just like with all the other agencies, build tools on the spot. With all that unstructured data, coming through the emails and other ways, we had to kind of build a tool within our Esri platform, which we specifically call the Pandemic Response Database. And that database was capturing a lot of the information that we're taking the unstructured data and making a way for the analysts to be able to query through, because it was scrubbing the internet from different sources for us. So we were trying to build that platform to be able to streamline a lot of the, the influx of, unstructured information. So we kind of built that tool along with other databases. I have data scientists on my team too. So on the spot, data scientists and geospatial analysts on my team. So, I had data scientists using ArcGIS Insights, to be able to collaborate a little bit more with my geospatial team on some of the visualization as well. So we were doing things in terms of analytic trend analysis, trying to do our best to look at the outcome, what's going to happen 30, 60, and 90 days, as an impact, critical infrastructure. Another project that we worked on to assist FEMA was, prioritizing PPE, and trying to gather data on that. We also were responsible for the essential critical workers list. That's what's a product that was pushed out through CISA. So, we were involved in a lot of things, and a lot of GIS products were produced, both static and interactive products as well.
All right, Georgette, thank you so much. Chris McIntosh, I was wondering if you can give us a specific use case where you use GIS for COVID planning.
Well, one of the big ones, and Tom was actually the brainchild behind this, was one of the one of the ripples of what was going on with state orders and all that is how it affected supply chains and the ability to move interstate goods. So if you're a truck driver and you're starting in Florida and you have to make a delivery in New York, you actually have, I don't know how many states you have to go through, each of which has a different set of rules that you have to know. Some required face covering, some didn't. Some had rest stops open, some didn't. And so if you're a truck driver, how do you know what you're supposed to do as you go from state to state to state? So working with the All Hazard Consortium, Idaho National Labs, and using some of that data that we mentioned earlier, an app was created which allowed a shipping company or independent operated or corporate to figure out, if I route myself from point A to point B, what are the rules along the way and what's the most advantageous route for me to take? Not based on traffic and those kind of dynamic things, but just based on the rules you had to adhere to. Because one of the biggest challenges for the operation of the economy was that there was 57, to use Chris's number, different sets of rules that affected interstate commerce and interstate movement. And so we worked together as a team to pull that together and provide a single resource where someone would know, if I get out of my truck in this state, I need to put my mask on, or there's going to be no rest stations, so plan accordingly, or where can I get gas? Are they open or are they not? All those kind of things that don't seem like a big deal taken individually, but when you can pull them all together, the way that they impact someone trying to do the critical function of moving these PPE and the food stuffs and all the kind of things that we saw on the news that there was impact on, it became pretty important. And so I was really proud to be a part of the team that worked together to bring that. And I think we helped out a critically and under lauded part of the response to COVID. You know, Tom, if you want to add anything to that, I saw you put the link in the chat.
Yeah, Rob, I don't know if you said it or if Chris or somebody said it about how we all jumped ahead a generation, right? One of the things that I notice is, for those of us that work in disaster management, these things are game day. This is what we train for, right? And we experiment, we save lives, we respond like that. And it's just amazing the engines that spool up so quickly to solve problems. And to mention what Chris mentioned there, was developing something very quickly, literally in 3 days, that would normally take a year and a half. Is it perfect? No way, right? But we know that working and developing it now, our goal was to get it in the hands of the private sector, right? Is how do we restore commerce and movement quickly was the goal of our private sector work group. We had no idea how we were going to do it, but isn't it interesting that the data, Rob, to your point, we didn't have 90 dashboards, right? I think we had one on Esri, and we did an Esri deployment. If I'm not mistaken, Chris, we budgeted 6 months. I think you guys did it in 6 days, if I'm not mistaken, right?
Yeah.
And was it perfect? No, but that data became the fundamental component to the decision making that led to the tool and 6 other products that we've been doing so forth. So it's a great discussion around why are we doing the data crunching like it? It's to get the driver or the decision maker authoritative, timely, actionable, reliable data so they can make a quick decision. And we've heard so many times, Chris, what you said is, what are the drivers going to do? What are the logistics dispatchers going to do in this environment of landmines logistically? For good reason. All these things were put in place for the right point. Save lives, stop the spread. They were all done for good reason. But boy, the impacts of that were no one saw coming. So hence, we're just touching the surface, Chris. I think this will be a longer term discussion afterwards. So.
Yeah, and Chris, Tom, the CRA tool is a perfect example of what's come out of all of this. And as Chris mentioned, Tom put the URL for the CRA tool in your chat box, so make sure you check that out. And the All Hazards also did a webinar that's downloadable from our website about with a demo on the tool if anyone wants to take a look at that. Or you can email me for the information, and I'll put my email in the chat in just a second.
And let me make one comment. The tool does not address very serious concerns about overweight vehicles, oversized vehicle running on side roads like that. We very quickly put this together, and now we're working to improve the routing and do it in a technically correct manner, which certainly is important. And that'll be kind of Rev 2, Rev 3 for hurricane season we're looking at right now. So to to us, the important thing was what problem are we solving, right? What is the problem we're solving? And let's focus on that, because you can get sideways many times on, hey, look at this widget. Hey, look at that widget. Hey, as I've done in my career. So these are an example. And I think these kind of discussions across HHS and FEMA and DHS are really, really important as we work together to coordinate operationally for the next one, whether it's a pandemic or a storm or disaster of some kind.
All right, thanks, Tom. Hey, Jeff. We'd love to hear from you on this question as well.
You know, I think a lot of great things have already been said, but I think another interesting angle to this question of use is around, you know, capacity, and also there was like some work done in a real kind of agile way from a capacity planning perspective. In Missouri, they basically used GIS to be their PPE inventory and tracking system, all kind of using you know, GIS. We saw, you know, many uses of our, you know, mobile technology by the community in terms of, you know, doing, you know, capacity planning. Even like we heard stories of firefighters taking their temperature and then logging it in GIS tools and then seeing it in a dashboard. So even just the little things became, you know, really important and were managed and innovated in new ways here from you know, from a GIS perspective. Even big box stores, you know, thinking about starting to use the tools to help manage, you know, how many people are actually in the store, and then communicating that back to a central location. So the use of the tools expanded beyond kind of our traditional expectations, I think, of what we would, you know, see in, you know, this type of event. Obviously already talked about how, you know, pandemic was new to us from, you know, never had experienced one before, but I think there's some real agility and, you know, great uses out there by the community to, in non-traditional ways, leverage the technology to support decision making. So,
Jeff, and I have to know the truth. Did you track me during the stay-at-home order when I left my house?
I didn't, but Facebook did, and Blue Dot did, and all the others. So, yep.
Very great answer.
All right. Okay, let's move on to initiatives. And Jeff, while we have you unmuted, why don't you talk about some of your current GIS initiatives?
So, you know, some of the things that we're doing now is, you know, is continuing to try and help the community, you know, the best we can. You know, there are many uses of Hub, and I think someone had shared our link here in the chat to help, you know, get information out. And I think this type of thing was replicated, you know, across the community. What are the key, you know, data sets? What are the key apps that are out there that are important? What are the best, you know, sources of information to kind of help, you know, make decisions? Part of that is also, you know, how to operationalize, you know, various models and get those out. So, you know, there may be a lot of like intelligence and logic that may be wrapped up in an Excel macro for a particular model. In some cases, we can help take some of those things in, you know, operationalize that, weaponize it, whatever you want to kind of call it, from a GIS perspective to help, you know, streamline, you know, workflow. So things like the CHIME model, the ensemble model that Chris talked about earlier, one of our teams has kind of translated that into a GIS tool and set of services that, you know, help kind of project, you know, some of the elements that, you know, are a part of there. So for us, it's really trying to help kind of get, you know, data out there. And data, apps, and tools. The other thing is really supporting, you know, the community through our disaster response program that we've run for, you know, 26 plus years here at Esri, really empowering the community with the technology for those that may not have had access. That was actually a clause that we had in our agreement with FEMA that we acted upon, you know, for this disaster to help, you know, broaden access to the technology for those that wanted to use it to support the response to COVID-19, and have had, you know, thousands and thousands of requests, you know, from across the globe, you know, leveraging that offer of using the technology. And we've seen, you know, great uses of that, you know, offer both, you know, domestically and internationally as well. You know, we talked, you know, I was looking at the hub site for Somalia the other day, and in the response to COVID-19. So the expansion in level of use kind of across the community, I think, has certainly really exploded, you know, as a part of that. So. And those are a lot of things that we're working on and doing our best to support the great work of our users that are out there doing amazing things, still working, 16 hours a day, whatever activation day you're counting, 111 or whatever it is, for you and your organization. Still people working hard to this day. So
There are. All right, Jeff, thanks so much. Chris McIntosh, I know you're still working with DHS, CISA, and Idaho National Lab on the CRA tool, but what are some of your other current GIS initiatives?
Oh, wow. Well, one of the things I really enjoy is that I get to work with a broad and diverse set of people. And some things are very interesting. Utilities. How does COVID affect the utilities' ability to operate their network and operate their restoration? Because utilities, emergency management is kind of bracing for what's the next thing that they're going to have to deal with. Some folks already are with some fires and some storms, but in a COVID world, what's the next disaster? Utilities are already there. There is outages that they're dealing with every day, every summer storm. So they are already dealing with how do we operate and do restoration in a COVID world. So working with them on trying to solve some of those problems, when you're used to bringing 70 people in and now you can bring in 12 because of social distancing. How do you communicate? How do you collaborate? How do you get the right information out to the right people when you used to do it in person? So that's a very interesting area. Other interesting is how do you plan for that hurricane when you're still in response to COVID? And this time of year, normally a lot of areas are focusing on the hurricane, a lot of state and local emergency management agencies, but they've been focused on COVID for so long. The hurricane season it's here now, and our sheltering plans aren't going to work. Our evacuation plans aren't going to work. We've got to come up with stuff really quickly. So working with folks trying to deal with that, capturing lessons learned from all this. We used to have two modes of operation for the most part in emergency management. We had everything was good and we had COOP, which was everything was bad. And this has forced people to look at that area in between the two. We're starting to coin this term adaptive operations. How do we slide along that continuum where we're not bad, like we have to go to a COOP facility and relocate everybody, but we can't work the way that we used to. So what are the procedures and techniques and technologies that we use to operate in that middle ground? So those are some of the big ones, and all those have major geospatial components, from where do I put people in an office building to keep them socially distanced, or in a gym if that's an evacuation center, to how do we share information when we're used to being in one place and looking up on the big screen, and now we're all doing it remotely. Big things like that. And I just returned from I just slid in sideways before this webinar started, driving from a state emergency operations center, whose eyes have been opened in many ways to the need for real situational awareness. And I think that this is maybe one of the big positives that came about, and what's a programmatic approach to that, so that all of this stuff, all of the evolution that Chris Vaughn talked about, doesn't get lost as we go into whatever the lull is before the next, metaphorical storm. So doing a lot of building programs, because the GIS is only as good as the people who use it, the knowledge that they have, and the leadership in that organization, and that has to be sustained so that they're ready for the next one.
Yeah, Chris, and I think it was you that gave the simplest piece of advice on one of our earlier webinars, which was simply write it down. So whatever you're going through now, whatever you're learning now, just make sure you're taking note of it and putting it towards good use in the future.
Write it down now, so you're not 6 months from now trying to remember, because you'll forget the pain points.
Right.
That's how we learn.
Thanks so much, Chris. Okay, let's move to the federal perspective on this question. Georgette, what are your current GIS initiatives?
So we have a number of different initiatives. Before we were, looking at, one of the things other than just the supply chain and commodity, but states that have, stay-at-home orders, finding ways to map that. States that adopted or partially adopted this is a essential working critical worker list. Now we're looking more into as they are lifting their home orders and business are reopening. One of the main projects, or one of the projects that we are working on, is looking at like tracking the hot spots, you know, and thinking about healthcare reporting in areas that are stressed, you know, and what are the emerging risks that could impact infrastructure. That is a question that's coming up with leadership, and we're just trying to identify the data sets to be able, authoritative data sets, to be able to answer those type of questions.
Georgia, thank you so much. Chris, how about you?
I'm waiting on Jeff Barani to text me back an answer.
Oh, I can skip to Rob Shankman.
No. That's because I'm gonna bust Rob. I think he said 90. So I think we, you know, from our bit, from an innovation standpoint, we ended up launching an interagency hub. It was the largest and biggest effort that we had ever done. Thanks, Jeff, for the update. We had over 700 applications registered in that hub site. So, you know, that was a really big deal, and I'm just poking my friend. But the innovation that we came out of, like Jeff said way earlier on in this conversation, is all 50 states, you know, territories were involved. The international community was involved. So this was really our biggest effort ever. And we learned so many great lessons. We took all of those lessons and we've launched a brand new hurricane, actually a whole new hub page for a variety of incidents: pandemic, hurricane, flood, tornado, earthquake. And so, you know, it's those lessons that we learned over these last couple of months about working with the interagency at this scale has really influenced what we are going to look like going into this hurricane season. So that's where all of our time and effort is focused right now. The other, and we're taking time to curate things like imagery and models and damage assessments, things that we just haven't, quite frankly, been able to do because we didn't really have the right framework. I think we've got that framework now. It's actually really great that everybody's teleworking. I feel like we're getting so much more done, even though Jeff looks like he's in the office. He's getting way more done at home. What his boss says, he's getting way more done where he is. So yeah, just a lot of great things happening because of this. Literally, we're all super hyper focused as an entire nation. I mean, we got, last thing I'll get off my soapbox. Sorry, we got like all these NGA guys that are used to working in a classified environment. Now they're home and they ain't got nothing to do. They're bored and they want to help. And they're driving me nuts.
That's great.
You know, we're giving them crap to do. So all these, you know, national security and intelligence people, like, God, get them back in a skiff. Just kidding.
Thanks,
It's
Chris.
recorded, right? Great, good.
Thanks, Chris. Hey, Rob, anything you want to add to this
Great.
question?
Our initiatives. So I'll add one thing to the initiatives. So this is our big thing now. I'm not going to say post-COVID, but post-COVID peak, at least peak one, is we are looking forward to hurricane season, both as it's a known thing. We're comfortable there. Like Chris said, we know natural disasters, that it's a small focused area. We know how to do it. So, but what we've decided we're going to do is create a threat matrix. So this is the initiative, is to take multiple layers of threats. So it's not just hurricane, break the hurricane down into its pieces and parts. It's a surge, it's a wind, it's a rain, it's a flooding, it's all of those, stack them on top of each other, including social vulnerability, including COVID, take all of that and the hospital infrastructure and the healthcare infrastructure and figure out what areas and what locations, both on the population side and on the infrastructure side, is in the most harmful situation, whether or not that's based on weather, whether or not that's based on population, and figure out where those hotspots are based on the aggregation of all that information. So we're working on this. We've currently slated about 30 different layers for us to aggregate and coalesce between those. and come out with what we've got as the threat matrix is the application, and the output we haven't yet coined, but we're trying to figure out a good name for that, and we'll see what it comes out. But that's the biggest initiative that we have right now.
All right, thanks so much, Rob. And I want to make sure we have plenty of time for Q&A at the end. We have a couple of people raising hands. So this is our last question, and it deals with innovations. We touched a little bit on it earlier in question number 2. But the question is, what innovations related to GIS have you identified? And Jeff, if we can start with you on this question.
Sure. So a couple things here. I mean, one, and Chris McIntosh already kind of touched on this. I think in a general sense, we have a raised level of both understanding and expectation of GIS at a senior leadership level, an executive level, and an elected official level. The bar has been, raised. I think oftentimes we hear in disasters. I was just looking back, the quote from the tornadoes in Tuscaloosa in May of 2011. The GIS analyst said, "Now my EOC knows what GIS can do." So, crises and disasters are often a wake-up call and kind of an education for that technology. And I think we're seeing that, at a magnitude we've never, experienced before. We've already talked about, some of the innovations from a data management side and operationalizing things. From a technology perspective, from innovations, there, a couple things to talk about. One, the amount of dashboards. Rob's got 90 dashboards, which is awesome. Everyone saw the John Hopkins dashboard, on the news, and all the GIS folks are now telling their friends and family, that's what they do. That's what I do. You saw the John Hopkins stuff on the news? That's what I do. That's my job. And so, now, even looking back at my old dashboard demos, they're crappy compared to what the level of expectations are now. Adding more things, into them. Another big, technical innovation that we saw, and Chris Vaughn spoke to this, was really the proliferation of hubs that were out there. Thousands of hubs were stood up, by the community, and for me, this, really is kind of putting GIS data and apps in context with the messaging, the agenda of whatever agency or jurisdiction was sharing out. Chris mentioned some of the statistics from the FEMA hub, and it's private, and there's different groups in there. And Chris, hopefully you don't mind me sharing this, but like the other day, we had a preacher request access to the hub who was a part of a volunteer organization in a region. So I'm thinking to myself, we've already got a general that's got access in here. So now we have a general, a preacher, and GIS analysts all working together. That's just mind-blowing to me in terms of the level of the community, kind of working together. Nothing negative against anyone. I think that's, actually phenomenal. I just would have never expected all of that, to really kind of, work together.
Hey, it sounds like the start of a really good bar joke.
That's where I was going. Same thing, Chris.
Yeah, we got to figure out the punchline, I guess. We'll still, that next webcast, I guess, next webinar. Yeah, but exactly. It's just like a bar joke. So, I mean, that also speaks, I think, to the technical or the agility of the technology, right? We've really it made it easier, folks, to leverage the technology. If firefighters are now making Survey 123 apps, on the fly to take their temperatures, is just absolutely kind of phenomenal. So the other thing that I think we were seeing is really GIS-based infographics. So dashboards are really popular to kind of help make decisions, but boiling that down even to simpler graphics, to communicating and synthesizing, information in a really easy to understand way with icons and numbers and trends that really kind of boil things down in a real, simplified way. So, I've realized we're getting towards the end of our time here, and I could certainly go on and on, but I'd certainly want to, communicate at that level. And the last thing I'd leave with is that there's just this unbelievable community momentum, I think, that exists to rise to the challenge for the next crisis, whether that be civil unrest or the next hurricane or locust or whatever it might be. I think the community is obviously maybe tired, but I think they're excited and are working and collaborating at a level they've never done before. So.
All right, Jeff, thank you so much. And Rob, I'd love to move to you on this question. Earlier, you mentioned methodologies you've had to come up with to handle all the information and data coming out. Can you tell us a little bit more about that?
About the methodology for sharing data? Yes, so sure. It was really based on requirements that are being put to us by leadership and by the requester. So we had a lot of information coming in, and we're given some basic guidance and basic guidelines on what was to be shared, and it would change based on who the requester was. So we had a White House task force, we had a FEMA task force, we had an HHS task force, and each one of them wanted to look at data slightly differently. Thus the reason for 90 different dashboards. But what we also found was people don't necessarily want to log in to our application and see the information. They wanted the information for their purposes on their software and on their instance. So we then and had already in process a methodology for sharing out that data as a service. So then we started pushing out data as a service, and we had that locked down on purpose based on the data restrictions that were put forth by the HHS Protect system. So then we had additional users come forward and say, well, I love the data, we can feed it in, I can't do all the analytics that I need. How do we deal with that? And so we came up with another solution where we actually push the data to them as a flat file. So they had to reconstitute it on their side, but it still worked for the process. It didn't violate any of our use agreements and data dissemination issues that we had on our side. So we had to constantly, like I said, so we were constantly changing. We had constant different asks from different groups for different needs. And then once we got into this rhythm where we sort of understood which groups were which, what their needs were, we started having more and more meetings with them. We could do as we do normally here for HHS, where we sort of put ourselves in the seat or in the mindset of that decision maker and say, okay, I understand what they looked for the first time. I see how the data is changing. What does that mean in terms of how their decision is going to be influenced? And are they going to need to just have the data change and understand that? Or should we, build out another dashboard that says, okay, your option 1 dashboard is here, but your option 2 dashboard is over here. And so you can compare the two. So that's how we really were kind of working through the different processes and how we were going to disseminate data out.
Great, Rob. That's awesome. Thank you so much.
Sure.
Hey, Georgette, how about you? Georgette?
I'm sorry.
That's okay.
Yeah. So for us, and that's Jeff kind of alluded to it. From our senior leadership up to the directives, they were big on visualization. Easy way to share and collaborate products. So a lot of the products that we normally would produce, say in a Word document or a PDF, making charts like a spreadsheet, we had to convert a lot of it into dashboards. I don't know if, like some of the products like our National Critical Function product is normally sent out as a PDF that shows more of a stoplight with the red, green, and yellow that consists of high, low, and medium. We converted that to a dashboard, an easy way to be able to visualize that information for users. So we built out a lot of different products based on the need, be able to share that with our CISA regions as well. So yeah, I mean, dashboards. Another thing was infographic. Be able to do more than just visualize something as a mapping product, but charts. Using different data sources from HHS, from census, be able to provide that insight to leadership as well.
Okay. All right, Georgia, thanks. Chris McIntosh?
A lot of good things. Two things I'll say. I want to reiterate what Jeff Barani said. Hub was the right tool at the right time. And, you know, we've bounced Hub around for what, Jeff, 3 years, something like that. But it hit the right level of maturity at the right time. And 3 months before COVID, you didn't see Hubs anywhere, and now they're everywhere. And they allow all this great content, all these great information products that were built, a way to organize them, a way to get them to people instead of a bunch of URLs or having to use, you know, some sort of other listing, and provide a real interactive experience for non-GIS users to access the information products. So Hub was key. The other big thing that was flexed in a way never before, but we couldn't have done what we did without, is web services. That allowed us to share information in a way. Can you guys imagine if we had to do this without web services? And what that would have looked like. So web services, the ability to share dynamic information between multiple organizations through the use of those services was key to the applications that we built, the dashboards that everybody used, you know, all of those types of things. We also learned a lot from the use of web services, what happens when everybody's relying on a common service, and what happens if there's a disruption in that service. We also learned what happens when a service provider changes their data schema and doesn't tell anybody and breaks 100,000 dashboards. Yeah, I see Jeff laughing. You know, we all lived that. So there's lessons learned too about the downfall or the dangers of this environment, but we're in, for the first time ever, a real information sharing environment that spans the entire country, a real-time information sharing environment powered by GIS. And that's exciting. Now, you know, the governance and the procedure things all are there that need to be ironed out, but the use of web services was revolutionary, transformational, pick your big word, allowing us to do the things that we've been talking about here.
Great. Thanks for the info, Chris. Thank you so much. Chris Vaughn, you get last comments and last licks.
All right, well, then I'll go in a completely different direction from the rest of my colleagues. You know, COVID for FEMA, we are a very ground-based organization. In fact, we attract a lot of people that, you know, like to go out into the field. And COVID changed all of that. It changed our policies. It changed a lot of what we traditionally do. And it really changed the game for how we do our normal day-to-day job. And so in the midst of all of this stuff that I've been a part of, we still had our normal day job. We had at least 5 major tornadoes that occurred. Nashville, Tennessee happened right at the beginning of COVID. Jonesboro, Arkansas, Soso, Mississippi, Alaska, Texas, and there's one more in there. Chattanooga and Cleveland, Tennessee, my hometown got hit with a tornado. So, the biggest thing that's happened to us actually in all of this is the adoption and the use and the willingness to actually use virtual remote sensing, virtual desktop inspections. And in fact, we've done a lot with artificial intelligence to do automated damage assessments following a major event like that. And that's just prepping us for the upcoming hurricane season. Less reliance on ground-based field observers. I don't think we could have had that conversation and as open as we've had it not been for something like COVID that really forced us to think differently about the way we traditionally do business. So that's it.
All right, Chris, I really appreciate it. And I'd also like to pose this question to all the listeners out there today. If you have any innovations that you want to share with us, please chat it. The panelists will push it out to everybody, and we'll have some time at the end where we're going to unmute everyone and just have an open conversation. And before we do that, I just wanted to, I know we have one more question, but I'm going to skip past this. We've kind of covered this a little bit on our innovations and kind of what's next. So I want to thank all of our panelists, Jeff, Georgette, Chris, and Rob. I appreciate your time and all the hard work you're putting into GIS and GIS innovations. So thank you so much for your time today. And Tom, I'm just going to pass the mic over to you real quickly.
Yeah, we want to thank our panelists here. We'll get into some Q&A. Want to invite those of you, many of you have already, if you want to register with the SICE. It's no cost at siceusa.org. I think this is great. The SICE was created to solve problems with better information in a safe environment. And I think from what I heard today, I just made a note of several use cases, that problems, if you will, that could be worked on by all of the groups, not just on the phone, but the private sector as well. We'll circle back later. So Laura, that's it. I'll give it back to you and we can get into questions and wrap it up.
Okay. I think a lot of you are familiar with Zoom. So if you're not, just hover your mouse over the top of your screen. You'll see a dashboard where you can enter a written question into either the Q&A section or the chat. And we're going to start that in just a second. And before we do, I want to mention that we have a couple of upcoming discussions. Our next one is going to be June 29th with Tom and Dave Jones of GeoCollaborate and on-off data sharing collaboration. And on July 13th, we're going to talk about how COVID has affected the logistics industry. So look out for that marketing from the All Hazards Consortium. And I also wanted to give you my email address, which is laura.johnson@ausa.org, in case you'd like a recording of the demo of the CRE tool or any other questions that you have. And let's go ahead and Tom, if you have ability to start unmuting people, I'm going to start reading the written questions and then we can move to verbal questions.
Okay.
Okay. So Jeff, I saw that you answered this directly to one of our listeners, Tony Hauser, but I thought it was worth reading out loud. Tony asked, I work in crisis management for an energy company, and one of my challenges has been narrowing down the COVID-19 data to only include our service territory. The process is a bit cumbersome, and I would be interested in learning if there are resources or dashboards that already exist that can help automate the updating of that type of territory-specific information. So Jeff, if you can share what you wrote to Tony with the rest of the listeners.
Sure. I think thanks, Laura, and thanks, Tony, for the question. I think the key part is the automation of that, of taking the data and then massaging it and filtering it to work to your territory areas or jurisdictions. And we saw many folks do that same type of thing. Obviously, there's the normal standard state and county, but if it's an agency that's got 10 different regions or 15 different regions, they're doing something similar. So common GIS techniques like using Python scripts to reorganize the GIS data into your service territory so then it can be presented on dashboards as one technique. And then in other cases you may be able to do tricks with filtering the data accordingly and aggregating the data accordingly to be able to report it in a way that matches your territories, your geography to achieve that goal. So yeah, it's really the trick is making the data work. So
okay, great. And for those of you who could see this Zoom, you'll see that we've promoted everyone to be able to speak. So if you have a question, you can unmute your own microphone and ask it, or even if it's just to say hi and introduce yourself. I want to say hi to Michael Prasad, who wrote an interesting comment. Did you see the sat map showing Sahara sand movement into the Atlantic recently? Good news, no hurricanes for the next few days. So thanks for that comment, Michael. And anyone else have a question or want to say hi?
Yeah, hi. I'm Pete DeSalvo from Data Capable, and was wondering how a company like mine could provide data. Like, what's the process for us to be a part of this and like provide what we have to the sites?
Peter, who do you work for?
Data Capable.
Yeah.
And I know some of you guys. I know Chris. I know Jeff. I think I met Tom before. How you guys doing?
Good. So Peter, first register with a SICE, okay? As soon as you do, I'll be notified. We can send you an email and we start the dialogue.
Yeah, sounds good. Thanks.
Okay.
Thanks, Peter. Don't be shy.
While people are unmuting, one of the use cases that came out of this was, well, there's been several. I know the private sector has a big interest in how state and county are gonna, if they're gonna look at daycare, right? It's kind of sheltering, but it's every day in a sense. Employers are struggling with it. I don't know if it's on anybody's radar screen yet, but it's going to be a big issue. And I was curious if any of the panelists had heard it, talked it, avoided it. We're tracking these public-private issues. That was one that was a big one. Any comments from the panelists?
Yeah. So this is Rob. So I've heard that topic come up. We have the Administration for Children and Families. That is they deal with a lot of daycare. They also deal with a lot of Head Start programs, and that is a huge issue. Is to understand, what do you do with those children that, well, first of all, what are you going to do with the children who are too young to go to school?
Right.
And so, they need those daycare providers, and who are those daycare providers, and how that's going to be done, and to possibly change some of the criteria for that.
Mm-hmm.
And then they're going a step further and with the Department of Education to understand, and I know it's being done currently on the county basis, but all of these kids still need to go to school. And there are issues with whether or not the child has equal access to the internet, equal access to technology.
Right.
And that's a piece that our group from ACF, especially for the Administration for Children and Families, is dealing with and working with Department of Education to understand how to make sure that education doesn't just drop for a year and push everyone back. Colleges are much more able to handle that because most kids show up with their equipment. But when we're talking about elementary school kids and middle school kids, how are counties and states dealing with that and coordinating that with our folks? So
Right.
There's no answer right now, but there's a lot of questions.
Yeah. No, it's a complicated issue. There's feeding, right? There's a lot of these kids
Right.
get their meals there. There's shelter. There's so many factors. We've had 3 that I know. We have 3 in our area, 1 closed. And
Right.
this was,
And part of so in the county that I'm in, they're already talking about potentially taking all of the schools and making them all elementary schools, and making middle school students and high school students come in 1 or 2 days a week, and that's it. They're going to rotate them. And that's all well and good, except now you have to think about, and Chris will know this, that schools are shelters during an evacuation. So now what do you do when you have all of these kids that are supposed to be in school, and you're now going to shut them all down again so that you can use, some of them for shelters? And so it changes the whole dynamic of everything that we do with surviving this first wave of COVID, and then seeing what happens in future waves as they go on.
right. Great. Thanks, Rob.
Yep.
Just have a couple more minutes before we adjourn. Anyone else want to say hi or ask a question of our panelists?
Wow. Why? Usually we go till like 9 o'clock.
We stun them, Tom.
It's great.
All right, that's great, guys. We appreciate all of you dialing in. You know where to reach us at the All Hazards if you have any questions. I'd like to thank Georgette, Jeff, Chris, and Rob, and Tom again for your time today. Really appreciate it. Great input. Thanks everyone for joining us. Stay safe out there. And that ends our webinar. Thanks, guys.
Thanks,
Thanks, everybody.
Thank you.